Good morning, friends. Today is a very special day. It's a very important day. World COPD Day, Chronic Obstructive Pulmonary Disease. Chronic means very long term. Obstructive means there is an obstruction to the airflow. Pulmonary is lungs. Of course, you know what disease is. I will do this in English, and in between I'll also make some Tamil quotes. It's very difficult to keep me away from Tamil. You all know that, right? Now, this is very special because our lungs are very important organs. We have a pair of lungs. It takes oxygen to your tissues. Oxygen is pranavayu. யாருக்கான உயிர் போயிடுச்சுன்னா என்ன சொல்கிறோம்? ஐயோ பிராணன் போயிடுச்சுன்னு சொல்கிறோம். That means it is life. It's like a lifeline, your oxygen. So when an organ like lungs is actually very essential for getting the oxygen to your brain, your heart, your kidneys, your liver, your blood vessels, everything, you know how important it is. Supposing the oxygen is not getting in enough quantity, your brain doesn't think. It's called like a brain fog, you know. You cannot think straight. Your heart cannot beat fast, beat properly or with strength. You can imagine your kidneys fail, your blood vessels become constricted. A lot of things, you know, a lot of things that can go wrong when you are not getting enough oxygen into your tissues. So the lungs are very important. COPD is a very common disease. It's probably one of the most common diseases of the old age, and all over the world, not just India, even rich countries. It's very common. It's one of the leading cause of death also. It's not just like a nuisance. It is something that is capable of causing death. Okay, it's a very high fatality also. And COPD is associated with a lot of other diseases. You know, as you're aging, you may get COPD, along with that diabetes, your blood vessel disease, hypertension, like blood pressure, so many other things that come with that. Poor nutrition, because of poor sleep pattern, generally you lose weight, you become very weak and very frail. COPD patients make a very pathetic sight. When you look at them, you feel very sorry for them. But the thing is, one of the most common cause for COPD is smoking. Pugai undan pagai. The smoke, you know, that the smokers, you know, like cigarettes or BDs or surut, whatever you call it, or a pipe, whatever is the smoke, it causes a lot of problems. The tobacco, it causes oral cancer, throat cancer, lung cancer. It also constricts the blood vessels, you know, not only your blood vessels in your body, it also constricts the blood vessels that go to the brain and the blood vessels that go to the heart. And you can imagine, if your heart blood vessels are getting constricted, you are prone for a coronary, what they call a heart attack. And also, over a period of time, this smoking can cause other problems as well. You know, it causes ulcer, it causes poor sleep pattern, it causes chronic sinus disease. And you can imagine from the head to the foot, உச்சி முதல் உள்ளங்கால் வரை பாதிப்பு கொடுக்கும் ஒரு நோய். This is smoking. I used to tell, when you look at the pack of cigarettes, you know, before you smoke, don't look at it as a pack of cigarettes. You look at it as your coffin. தமிழில் சவப்பெட்டின்னு சொல்லுவாங்கள்ல, அதே மாதிரி அதை பாருங்க. இந்த மேட்ச் பாக்ஸ் இருக்கே, that is something that's going to light the cigarette. But if you don't have faith in your children, after death they are going to do all the, you know, rituals. You are doing it yourself now. சந்ததிகளை நம்பாமல் தனக்கே தான் வைத்துக் கொள்ளும் கொல்லி இதுதான் சிகரெட் அப்படின்னு கிறுக்கல்னு ஒரு கவிதை தொகுப்பில் நடிகர் பார்த்திபன், அவர் கிறுக்கலாக சொல்ல நல்ல புத்திசாலித்தனமாக சொல்லியிருக்கார். இந்த கவிதை வரிகள் அப்படியே மனசில் நச்சுன்னு பதியும். அது எல்லாம் ஞாபகம் வச்சுக்கும். ஸோ யூ ஹேவ் டு ரிமெம்பர், சிகரெட் ஸ்மோக்கிங் இஸ் வெரி வெரி ஹெசார்டஸ், is as bad as drinking. On top of that, cigarette smoke also causes problem to people around you, what you call a passive smoking. I'm not smoking, but somebody next to me is smoking, and I'm inhaling the smoke. That's called a passive smoke or a second-hand smoke. That is equally dangerous, or that can be more dangerous. So you have to remember those facts. Coming back to COPD, we have to remember this November. Today is 16th August. This is a very important day. All over the world, doctors dealing with lungs, respiratory problems, they think it's a very special day, and they have to respect this disease and treat it aggressively. There are fantastic medicines available. There are wonderful inhalers that have come now in the market. New medicines have come for treating COPD very effectively, provided you take those medicines regularly every day and have probably a nebulizer at home for emergencies. You will be able to control your COPD flare-up and lead a near normal life. Also important that all COPD patients get flu vaccine and pneumonia vaccine, because in COPD patients, when they get a flu or pneumonia, they have an added danger of getting it a very severe form, and they even die of that. So those are things that you all have to remember. I cannot just go over all details of COPD, but it's very important you remember it's a disease. It's mostly seen in smokers, but it's also seen in non-smokers. It's also seen in females. They may not be smokers. Of course, in a lot of countries, even in India, there are a lot of female smokers also now. It's very sad. But ladies who are in the kitchen, who are not having access to the gas, they are just using the coal oven and other things, they are exposed to the smoke, right? They can also get COPD. So you have to remember, female COPD is becoming an entity. It's something that you have to recognize and treat, just like you are treating a male COPD patient. So smoking, anti-smoking campaign is very important. Public awareness is very important, and awareness about inhalers and the safety of inhalers and the effectiveness of inhalers and the long-term benefits of inhalers, because it's going to save you from dying. It's also going to save a lot of morbidity, sufferings. Every day you are going to have a sleepless night because you are coughing. It's very sad, right? You cannot be very productive. So you need to have an active life. And people who are like in 40s and 50s, when they begin to dwindle, like begin a journey towards death, that's very sad, because now the average life expectancy is more than 70, 75, and it's a shame if people die when they are like in 50s, and because of heart attacks, they even die at like 40s and 30s because of heavy smoking. You have to realize that smoking is very dangerous, and COPD is a disease that you should know about it, and you should be able to face it with the help of a very empathetic, efficient, experienced, knowledgeable doctor. Okay? Just keep all those things in your mind. If you have any questions, feel free to contact me in the YouTube channel, and spread this message. All medical informations, useful informations, and scientific informations have to be dissipated. All kinds of rumors are just spreading like a viral, just like corona, it's spreading. But authentic medical information is very rare to reach the people who really need it. So you have to keep that in mind. Thank you, friends. We'll see you some other time. And I'll just make a quote from Thirumandiram. ஏற்றி இறக்கி இருகாலும் பூரிக்கும் காற்றை பிடிக்கும் கலையறிவாரிலே காற்றை பிடிக்கும் கலையறிந்தாலே கூற்றை உதைக்கும் குறியதுவாமை. This means if you are able to control your breathing, you know how to inhale, hold the breath and exhale. If you have a control over your breathing, you can even tell Yaman, the guy who is in charge of death, Yaman. So when he comes, he just say, I'm not ready for you, just get lost. I'll call you when I'm ready. Like that you can tell. This is what Thirumandiram says. That is Thirumalar. For 2000 years back he says how important it is to have a control over your breathing. So with that Thirumandiram, let me quit, and I will come back with another episode of some important information. Thank you.